According to the World Health Organization, WHO, Al-Afa Hospital in Gaza, which was once considered the largest and most advanced medical complex, has now been reduced to an empty shell with human graves. The situation at the hospital is dire, with the staff discovering partially buried bodies and a strong odor of decomposition upon gaining access to the site. The destruction at Al-Afa Hospital is extensive, with most of the buildings lying in ruins and a significant portion of the medical equipment completely destroyed. It is highly unlikely that even basic functionality can be restored in the near future. The emergency department, in particular, has been devastated, and the destruction is evident throughout the entire area. In addition to the physical damage, there is also a pervasive smell of sewage and decomposing bodies in the vicinity. This further adds to the challenging conditions faced by the hospital staff and patients. On Monday, Israeli forces withdrew from Al-Afa Hospital in Gaza City after a military operation targeting what they claim to be regrouped Hamas fighters. However, the Israeli army has faced allegations of recklessly endangering civilians through this and other devastating attacks on Gaza's already overwhelmed health sector. The health sector in Gaza is already grappling with a substantial number of injured Palestinians, and such attacks further exacerbate the situation. The WHO and other international organizations have expressed deep concern over the destruction of Al-Afa Hospital and the impact it has on the provision of healthcare services in Gaza. The targeting of medical facilities and personnel is a violation of international humanitarian law, which emphasizes the protection of healthcare infrastructure and the right to access healthcare for all individuals, regardless of their affiliation or nationality. Efforts are underway to provide emergency medical assistance and support to the affected population in Gaza. However, the road to recovery for Al-Afa Hospital and the healthcare system as a whole will be long and challenging. International support and advocacy are crucial to ensure that such devastating attacks on healthcare infrastructure are not repeated and that the right to access healthcare is upheld for all individuals in conflict-affected areas. The health situation in the Gaza Strip is currently facing a tragic and disastrous state. It is of utmost urgency that we appeal to individuals worldwide to extend their support to the healthcare sector in both Gaza City and northern Gaza. Despite the ongoing conflict, it is disheartening to note that out of the 36 major hospitals in Gaza, only 10 are currently operating to some extent.